All right, now that we've read over chapter 24, performing chest physiotherapy, now we're going to go back and do a review, see what we know. So what do you think chest physiotherapy is? It's external wall manipulation, which includes one of a combination of or all of percussion, vibration, postural drainage to loosen and remove secretions from the patient's airway. Okay? So what do we do to determine which regions would benefit from chest physiotherapy? Osculate all lung fields. What type of patients do you think would use chest physiotherapy and postural drainage in? CF, bronchiectasis, stuff like that. What are some examples that would be contraindications for postural drainage? Increased intracranial pressure, head and neck injury unit stabilized, active hemorrhage with hemodynamic instability, recent spinal surgery or acute spinal surgery, active hemoptysis, impemia, bronchopleural fistula, pulmonary edema associated with heart failure, large pleural effusions, PE, age, confused or anxious patients who are unable to tolerate position change, rib fracture with or without flailed chest, surgical wound or healing tissue, and then Trendelenburg's position is contraindicated on the following: uncontrolled hypertension, distended abdomen, esophageal surgery, recent growth hemoptysis, uncontrolled airway at risk for aspiration. All right, what is postural drainage? It's the use of positioning techniques to drain secretions from specific segments of the lungs and bronchi into the trachea. So how are we going to drain the left and right lobe anterior apical bronchi? We're going to position the patient in chair or put him in high Fowlers, leaning back, and we're going to percuss and vibrate with heel of hands at shoulders and fingers over the collarbone or clavicles in front. Do it at the same time, okay? How are we going to drain the left and right upper lobe posterior apical bronchi? We're going to position patient in chair, leaning forward on pillow or table, percuss and vibrate with hands on either side of upper spine and do both sides at the same time. How are we going to drain the left and right anterior upper lobe bronchi? Position the patient flat on back with small pillow under the knees, percuss and vibrate just below clavicle on either side of sternum. How are we going to drain the left upper lobe lingular bronchus? Going to position patient on right side with arm overhead in Trendelenburg's position with foot of bed raised 30 centimeters to 12 inches to tolerate. Place pillow behind back and roll patient 1/4 turn onto pillow. Percuss and vibrate lateral to left nipple below axilla. How are we going to drain right middle lobe bronchus? Position patient on left side of abdomen. Place pillow behind back and roll patient 1/4 turn onto pillow. Percuss and vibrate to right nipple below axilla. How are we going to drain left and right anterior lower lobe bronchi? Position patient on back with foot of bed elevated to 45 to 50 or 18 to 20 inches. Have knees bent on pillow. Percuss and vibrate over lower anterior ribs on both sides. How are we going to drain right lower lobe lateral bronchus? Position patient on abdomen in Trendelenburg's position with foot of bed raised 18 to 20 inches to tolerate. Percuss and vibrate on left and right sides of chest below shoulder blades, posterior to mid-axillary line. How are we going to drain left lower lobe lateral bronchus? Position patient on right side in Trendelenburg's position with foot of bed raised 18 to 20 inches to tolerate. Percuss and vibrate on left side of chest below scapulus, posterior to mid-axillary line. How are we going to drain right and left lower lobe superior bronchi? Position patient flat on stomach with pillow under stomach. Percuss and vibrate below scapula on either side of spine. How are we going to drain right and left posterior basal bronchi? Position patient in Trendelenburg's position with foot of bed raised 18 to 20 inches to tolerate. Percuss and vibrate over lower posterior ribs on either side of spine. So when it comes to postural drainage, do you think you can delegate this? Yes, you can. So let's say someone's getting an inhaled bronchodilator, nebulizer, or aerosol treatment. When should you do postural drainage? 20 minutes after that therapy, okay? All right, so let's say you are doing the postural drainage for these next two things. You're doing postural drainage, and they have dyspnea, bronchospasm, hypoxemia, hypercarbia, and is unable to tolerate treatment. What would you do intervention-wise? Discontinue, modify, or shorten the treatment. Give a bronchodilator or nebulizer therapy 20 minutes before the CPT, then suction and ventilate with bag masks to improve patient oxygenation, closely monitoring AVG levels, oxygen saturation, and vital signs. How about what if there's no improvement in chest assessment or chest x-ray film examination results? So you increase treatment and encourage and teach coughing exercise, increase hydration if that's okay, notify healthcare provider because patient may need sputum culture, change antibiotics, mucolytics, or bronchoscopy to remove thick mucus plugs. What if hemoptysis occurs or patient develops acute hypotension, severe chest pain, vomiting, aspiration, and dysrhythmias? Going to stop therapy, place them in high fouling position, and obtain vitals. Call for help and notify healthcare provider. Remain with patient, keep them comfortable, calm, warm, and quiet. If they vomit or aspirate, suction airway and place him or her on his or her side. Reapply patient's oxygen if ordered. So what would you think the best times for postural drainage treatments would be? In the morning before breakfast, when patient can clear secretions that accumulate overnight, and about 1 hour before bedtime so lungs are clear before sleeping and patient has time after treatment to cough up any mobilized secretions. So when it comes to using an Acappella device, do you think you can delegate this? Yes, you can. So there's a blue and a green Acappella device. When would you use the blue Acappella device? That's for patients who cannot maintain their expiratory flow above 15 liters a minute for greater than 3 seconds. When would you use the green Acappella device? That's for patients who can maintain expiratory flow above or equal to 15 liters a minute for at least 3 seconds. So let's talk about being able to percuss and vibrate. Do you think you can delegate this? Yes, you can, but they have to be trained to be able to do it.